Today we will walk you through your journey in tongue reconstruction. The information provided in this video is the general outline for a typical patient. Ultimately, every patient is different and the recovery time and extent may vary. Mr. Tan is going to see the reconstructive surgeon today at Tan Tock Seng Hospital.
Hello Mr. Tan, you are here today for the treatment of your tongue cancer.
Okay, doctor.
Let me explain the surgery to you. During the surgery, your tongue tumor will be removed and my team will use your thigh or chest tissue to reconstruct your tongue. Now let's go through the things you need to take note before, during and after the surgery. Before surgery, it is important that you have adequate nutrition. Underweight patients may need to see a dietitian. If you are diabetic, you will need to control your blood sugar levels. Impact: a nutritional supplement will be prescribed 5 to 7 days before the surgery. Smokers should stop smoking as soon as possible, preferably at least 2 weeks before surgery. Blood pressure control is also very important. All traditional medications should be stopped. During the surgery, we will harvest skin fat and some muscle from your thigh. The tongue tumor will be removed and the thigh tissue will be used to create a new tongue. This is an example of how the thigh wound will look like. In some patients, the skin and muscle from the chest is used instead. The risks of surgery include salivary leak and bleeding, which may be life-threatening. Other risks are flap failure, damage to surrounding structures causing numbness and weakness, scarring and wound infection. If you are undergoing free flap surgery, there is additional risk of blood clots within the vessels and a need for relook surgery. The recovery period is usually about 1 month. You will be at the ICU for the first day and slowly step down to the general ward. You may be admitted to a community hospital for further rehabilitation before home. In terms of nutrition, you will be given tube feeding for at least the first 3 weeks before you begin to eat normally through the mouth again. But this depends on the amount of tongue you have left, and some patients may be on longer-term tube feeding. You will be resting in bed for the first few days after surgery, but you should be able to start walking from day 4 onwards with the physiotherapist. It is also very important to keep your head neutral in the midline after the operation. When you wake up after the surgery, you will pass urine through a tube. This will be removed once you are walking well. Most patients will have 2 to 3 plastic bottles to collect excess fluid and blood at the surgery site. These will be removed within 1 to 2 weeks. You will have a hole created at the bottom of your neck to protect your airway after surgery. This hole can be removed eventually in most cases, at variable time points from 3 weeks onwards. You will not be able to talk during this period. After the surgery, your speech may or may not recover back to normal depending on how much of your normal tongue you have left. This is the speech of some of our patients after surgery.
It has been about 9 months since my surgery. Yeah, so for now I'm coping quite well. Yeah, and recovering quite well.
It has been a long 5 years, so far so good.
How well you can chew and swallow also varies, and some patients may need to eat soft food like porridge and oats, while a small proportion of patients may need to be on tube feeding for life. That's all I want to share with you about the surgery. Do you have any questions, Mr. Tan?
Thank you very much, doctor. I feel ready for my surgery now.